Hi, once again welcome back to Obstetrics and Gynecology videos. Today in this video we are going to see about an important and interesting topic that help us to have a better generation. So here we are going to see about certain things we should do or we must do for taking care of our own children or our own next generation. In that the main thing that we are supposed to do is preconception care. See, we know that in India, naturally, during the time of pregnancy, majority of the females are getting better care and concern. But before the pregnancy, maybe due to the lack of knowledge or maybe due to the ignorance, these ladies are totally ignored and they are not getting any form of care. Actually, the care of the ladies should start before the onset of pregnancy. It is not a thing which is supposed to start from the time of onset of pregnancy. It should start earlier to the pregnancy. So today we are going to see about that. Preconception care. Its objective is it identifies reducible or reversible risk. See, if the mother is having any form of risk factors and if that risk factor is going to affect the pregnancy or going to affect the child adversely, so such conditions we can reduce or we can avoid. That is one objective. And second thing, maximizes the maternal health. If you are giving proper care and support for the mother, even before the onset of pregnancy, the health status of the mother will be better and we can maximize it. And intervenes to achieve outcomes. In case if you want to have a better outcome, you need to do some interventions. So those things you will get time to do it before the onset of pregnancy. These are the objectives of the preconception care. Now let us see the continuum of reproductive health. Actually, if you want to have a better child or if you want to have a child without any abnormality and if you want to have a healthy child, you should begin the care or we should start to give care for the lady before the conception. Normally we used to start after the beginning of the conception, but we should start before the conception and it should extend through the pregnancy and even after the delivery also for 1 year. Next, for 1 more year we are supposed to continue that care. So the care of a pregnant lady or a lady should start so early before the pregnancy and we should continue it throughout the pregnancy and even after the pregnancy also for 1 more year that lady is supposed to get proper care and support. And now we can see the elements of preconception care. The elements of preconception care include assessment of the risk factors, education and health promotion, medical and psychosocial interventions. The components include taking a detailed medical history. So we should take the history of alcoholism, drug abuse, and we should take the history of, we should ask to the mother whether she is having a family history of genetic disorders, any chromosomal disorders in the family, whether we should ask about her own health status, whether she is having any communicable diseases, whether she is having any other form of hereditary diseases. So such detailed history we should collect from the mother. And psychosocial issues, whether the lady is having any psychological problems or any psychiatric disorders, whether the family is having any social issues or psychological issues. All these things should be collected, all this history should be collected from the mother. And if such things are there, means it should be addressed well. And another one is physical examination of the mother. And it includes not only the physical examination of the mother, it is better to include her partner also, so that you can identify the communicable diseases, especially the sexually transmitted diseases and all. So a detailed physical examination of the mother should be performed. It is better to include the laboratory investigations, especially the blood examination, to identify the diseases and to assess her hemoglobin status. So that laboratory test also should be done along with the physical examination. And next is family and genetic history. Already I have told you that along with the medical history, you should collect the family history of communicable diseases. You should collect the family history of genetic diseases, chromosomal disorders, those things. and including not only the diseases in the family, health status of the family, socio-economic status of the family, family relationship, marital harmony, all those history should be collected, because those factors are going to affect the pregnancy and even the outcome of that. Next is nutrition assessment. We should take a detailed history we should take a detailed nutritional history of the mother. What type of diet she is taking, what are the dietary habits, is there any food items whether she is taking which is harmful for her health, whether she is taking all the adequate nutrients, vitamins, minerals, and all those things. So this history you have to take. And next, occupational and environmental risk assessment. Sometimes she may be working in an area where environmental hazards are there. Sometimes she may be getting exposed to the X-rays, harmful radiation, or sometimes in her work atmosphere, lead exposure will be there, or otherwise ionizing radiation will be there. So such history also should be taken. Sometimes the mother may not be having, but husband may be having such exposure. So that history also should be taken, because if they are having such exposure, there is a chance for birth defects for the baby. So these are the main components of the preconception care. Next, we will see about the risk assessment in detail. In the risk assessment, you should take the measures for the STD prevention, that is sexually transmitted diseases. You should conduct blood examination, you should do the physical examination, you should do all the investigations, and you should identify whether the partner and the lady is having any form of sexually transmitted diseases are there or not. Next, genetic issues. Domestic violence. If domestic violence is there, means sometimes during the pregnancy she may get attacked, or it may produce psychological effect for her, and it may affect the outcome of the pregnancy, and whether the family members and whether she herself is having the history of substance abuse. For example, whether she is using alcohol, tobacco, any other form of illicit drugs, that history should be taken, and that history of the husband also should be taken. So these are the risk factors. And the environmental teratogens exposure, whether it is at the workplace or in the home environment, that should be taken thoroughly. That is exposure to the ionizing radiation, lead, mercury, hypothermia, any form of herbicides or pesticides. If she is having such exposure, that history should be taken, and in such cases we should advise her to avoid the pregnancy, or we should advise her to change the environment. Otherwise, from that environment, if she become pregnant, there is a chance for complications for the baby, and even she may get complications during the time of delivery or pregnancy also. Health education and promotion. You should give health education about the cessation of smoking, or importance or need for stopping the smoking. If the mother is having the history of smoking, there is a chance for abortion, there is a chance for growth retardation of the baby, there is a chance for birth defects of the baby. So these things should be, sometimes she may be doing this smoking because of the lack of knowledge. So it is the responsibility of the healthcare provider to give education about this smoking and the effect of the smoking on pregnancy, and about the folic acid supplementation. That is the second factor. If you are giving adequate folic acid supplementation before the pregnancy, you can prevent neural tube defects to a certain extent. So that should be given. And genetic counseling also should be given. That is, when you are taking the history, you should take a detailed history about the family history of genetic disorders, and if such things are there, means you should advise her about the chances of recurrence or chances of getting genetic disorders for the child also. Dietary and nutritional advices. We should give education about the well-balanced diet. So you should tell her about the importance of including calcium-rich food, vitamin-rich food, iron-rich food, and you should tell her about the importance of fluid intake. All these things you should educate her, and it is better to prepare a good menu plan, affordable good menu plan for the woman if they are not taking the diet properly. And the conditions that need time to correct prior to the conception. That is, if the mother is having overweight, that should be corrected, and if the mother is having underweight, that also should be corrected before the pregnancy. And if she is having if she is using any form of medications. For example, sometimes she may be a diabetic patient and she may be using oral hypoglycemic drugs. In that case, we should change that and we should go to insulin. So such choice or such discussion should be taken, and that decision should be taken before the pregnancy. And if she is having the habit of substance abuse, alcohol abuse or smoking or drug abuse, that also should be stopped. And medical conditions amenable to preconception care. If the mother is having these medical conditions, we should be very conscious about the pregnancy, and if possible we can advise the mother to avoid the pregnancy. If she is having severe diabetic mellitus, if she is having uncontrolled hypertensive disorders, cardiac diseases, thyroid diseases, epilepsy, asthma, HIV, systemic lupus erythematosus, thromboembolic diseases, renal diseases, hemoglobinopathies, cancer. In these cases, you should educate her about the effect of these conditions on pregnancy and the effect of these conditions on the baby also. And after that, we can make her to take a proper decision. It is a responsibility of the nurse to educate about the consequences and making her to take a good decision. Interventions that usually we are not supposed to undertake during pregnancy. We should not take rubella vaccination because it's a live vaccine. There is a chance for getting infection, viral infection. Rubella and varicella vaccination you should not take during pregnancy, and you should not go for the narcotic detoxification during pregnancy, and you should not go for the radiological exposure or radiological exposing procedures, and thyroid ablation with radioactive iodine, that also should not be done during the pregnancy. These procedures we should avoid during the pregnancy. And interventions considered because pregnancy is planned. In case if you are planning for a pregnancy and if the mother is having mitral stenosis, you should do the correction of mitral stenosis. It is better to do that. And if the mother is using hypoglycemic drugs, it is better to switch to insulin. And if she is taking anticonvulsant drugs, it is better to consult a doctor and either to reduce the dose or to change the medicines if possible. And in the below mentioned cases, actually we should advise the mother to avoid the pregnancy or to extend the timing of or change the timing of pregnancy. For example, if they are having the history of domestic violence, if birth spacing, that is if the previous child is not having minimum 2 years, if the family is having the history of genetic disorders or chromosomal disorders, and if the mother is having AIDS and if the prognosis is poor, and if she is having any other diseases which are dangerous for the pregnancy, for example congestive heart failure, and if she is having the history of recurrent pregnancy loss, in those cases actually they should think twice, or otherwise they should take or they should delay the pregnancy till the conditions are becoming favorable. And is it effective, this preconception care, whether it is effective or not? Actually, if you are going through the analysis of the history, we can see that the preconception care, if you are doing properly, it is reducing the infant fetal mortality rate and it is decreasing maternal mortality and morbidity rate also. And the goals of preconception care in diabetes mellitus includes in order to reduce the recurrence of obstetric and diabetic complications, in order to decrease the incidence of congenital abnormalities, and in order to decrease the risk of spontaneous abortions. And how we can accomplish these goals means educate about the need to change diabetes medication regimen and tell her to substitute with insulin. Oral hypoglycemics should be substituted with the insulin, and optimum glucose control should be there, and you can before the starting of pregnancy the glucose level should be under control, and if it is not coming under control, it is better to postpone the conception. And other risks are there if it is associated with diabetes. Sometimes they may be having damage for the kidney, retina, vasculature, heart, nervous system. Those complications may be there because of the diabetes, and if such complications are there, means it is better to think about the importance of a pregnancy, or it is better to reassess the need of a pregnancy. And next is about the alcohol consumption. You should educate the mother that may leads to the mental retardation of the baby, and it's a teratogen in which fetuses, if it is getting exposed, it will produce mental retardation, and it may produce even other defects for the baby. And actually the effects on the baby depends on the dose of alcohol, and it is better to avoid this alcohol. Even if it is in mild amount also, it is better to avoid the alcohol even before the pregnancy and even during all the stages of pregnancy. So that thorough education and awareness should be given to the mother. And next is rubella vaccination. Already you should see whether the mother is vaccinated or not in the pre-pregnancy period itself. Otherwise, vaccinate the lady in advance before the onset of labor. Otherwise, during the pregnancy, if she is getting rubella, she may get a baby with microcephaly, or the baby may get the growth retardation, or the baby may get the cardiac malformations. Tell her all these complications, and if she is not vaccinated, tell her to take a vaccine and wait for few months for the next conception. And for the prevention of neural tube defects, already I have told you that folic acid supplementation should be given for the mother. And if the mother is having no history of neural tube defects, 0.4 milligram can be given for the mother. And if the mother is having a prior infant, having the history of a previous baby with a neural tube defect, 4 milligram should be given. And if the woman is with a neural tube defect, in that case also 4 milligram should be given. And you should make sure, you should see whether they are getting adequate amount of folic acid from the food supplements. That also you should see. And next we can see the barriers for the preconception care. That includes barriers from the side of patient, from the side of caregivers. So those things are there. So first let us see about the barriers from the side of patient. Sometimes the pregnancy may not be a planned pregnancy. If it is an unplanned pregnancy, we may not get a chance for giving preconception care. And sometimes the public or the lady may not be having any awareness about the importance of this preconception care. So in that case, she may not go for that, or she may not even listen for that. And sometimes the lady may not be having an access for the preconception care sources where she is getting. She may not be knowing sometimes, or sometimes she may not be having the financial status to access it. So these are the barriers that can come from the patient side. And the barriers come from the provider aspect. Sometimes the healthcare provider may not be having adequate knowledge, or sometimes the healthcare provider may think that it's a time-consuming process, or sometimes they may think about the insurance reimbursement, all those things, financial aspect. And sometimes they may be having lack of awareness of how to integrate preconception care into ongoing primary care. They may not be knowing when to give it, how to give it. So those things also may act as a barrier for the preconception care. Other barriers include availability of contraceptives, health insurance coverages, and out-of-pocket expenses. And when we are supposed to give the preconception care, it should be given to all the ladies in the reproductive age. So there is no time, and we should not think that we can give it after the marriage. It's not like that. Preconception care should be given to all the ladies, those who are in the reproductive age. And preconception care for men. And this preconception care is not only for the females, it should be given for males also. If the male is having the history of alcoholism, it is better to avoid it, because it will affect the financial status of the family. It will affect his own physical and emotional status, and there's a chance for decreased fertility also. So that education should be given to the male. And genetic counseling also should be given in case if the family if he is having any family history of genetic disorders, that should be taken. And occupational exposure, whether he is getting exposed to any of the occupational hazards, whether he is getting exposed to X-ray, lead, all those things, that history also should be taken from the man. And if he is having such history, it should be avoided. And we should take a history of the sexually transmitted diseases. If the man is having the history of syphilis, herpes, HIV, in those cases also, we should treat that. And it is better if the HIV is there and if it is severely complicated, it is better to avoid the pregnancy. We can educate him about that. And who is supposed to give the preconception care? It can be given by the obstetrics and gynecologists, pediatricians, family medicine practitioners, interns, by the nurses, nurse practitioners, nurse midwives, even genetic counselors and health educators. Even a primary health nurse, when they are going to the home visit, going for the home visit, they also can give. That is health education, they also can give. And even it's a responsibility of a student nurse also should give the preconception care. When should preconception care be offered? See, when you are giving the routine health maintenance care, sometimes the couples or the lady may come to the hospital for the regular checkup. In that case, you can give. Or sometimes they may come for a preconception visit. During that time, you can give. Or sometimes a woman may come for the treatment of other diseases, other chronic illness. That opportunity also you can use for the preconception care. How preconception care can be integrated into practice. See, when you are going for the routine medical visits, you can give the preconception care for the eligible couples. And if the person is coming to the hospital for the episodic complaints, if for the common complaints, that time you can do it. And if the lady came to the hospital for testing the pregnancy, and if the pregnancy is negative, that time onwards you can give preconception care for the next pregnancy. And in the family planning encounter or in the infertility evaluation, when you are assessing the woman for the causes of infertility, you can give. And if the mother is having a poor pregnancy outcome, if the mother is having a history of previous bad history, that means previous history of bad outcomes of pregnancy, for example death of the baby or any defects of the baby, in those cases also you should start to give the preconception care. So that's all about the main aspects of preconception care. Thank you for watching this video. See you soon with the next video.